Austria re-entered a full national lockdown on Monday, becoming the first country in Western Europe to take such a measure since vaccines were rolled out. The government hopes it will curb the surging COVID-19 infections. Last week, a lockdown of unvaccinated people was implemented, but now everyone is being asked to work from home and non-essential shops have been closed. Austria has also become the first European country to make coronavirus vaccines mandatory. Over the weekend, protests were held in several European cities, including Brussels and The Hague, against the renewal of pandemic restrictions. Hospitals in Germany have warned that ICU capacity is almost at breaking point as the country recorded 30,000 COVID-19 cases over the past 24 hours. It's now on the brink of passing 100,000 coronavirus-related deaths since the start of the pandemic. With only about 68% of the population fully vaccinated, the health minister issued a stark warning to Germans.
A situation that we have been describing for months. At the end of this winter, pretty much everyone in Germany, one could call it somewhat cynical, will be vaccinated, recovered or dead. But it is actually so. With the very infectious Delta variant, it is very, very probable. And that's why we are so urgently recommending the vaccine. Also the first vaccine, that whoever is not vaccinated will get infected without protection over the next months, unless he goes through life very, very carefully. So immunity will be achieved. The question is whether it is through vaccination or infection. And we recommend emphatically the way through vaccination.
An independent body tasked with assessing the global response to COVID-19 says governments are not moving fast enough to end the pandemic. The report released by the Independent Panel for Pandemic Preparedness and Response says that there's been an uneven distribution of vaccines and vaccine wastage. It's also calling for the creation of a global pandemic treaty. Let's cross over to Strasbourg to speak to our correspondent, Shona Murray. Shona, great to see you. It seems like we've been here before. EU countries once again introducing stricter measures to stem the latest COVID wave. MEPs discussing the bloc's response. Will it lead to any action?
Well, I mean, certainly it's down to the member states at this point to implement the type of restrictions that they see fit, given hospital numbers, ICU figures, deaths, cases and of course number of vaccinated. We know, as you mentioned there, Austria has a actually the lowest vaccination rate in Western Europe, around 64%, and we've heard Chancellor Schallenberg say that this was not good enough, and that's why he initially proposed restrictions only on the unvaccinated, but now is the first country in the world to say that everybody has to get vaccinated come February. And we've also heard, as you mentioned there, Jens Spahn making the point that people are essentially obligated to get vaccinated if they want to save their lives or at least save their health. So it's down to member states based on those issues. But there has to be a discussion. There will be certainly amongst MEPs tonight at the Parliament in Strasbourg and also tomorrow in Brussels with European Affairs Ministers in relation to boosters and in relation to travel, though I don't think any country wants to go back to any sort of travel restrictions around the bloc. Paul?
Yeah, you mentioned booster shots, maybe better coordination regarding travel. How long before we see any of these measures put in place?
Well, every country has already started booster shots, or at least considered them, certainly in Belgium, in France, in other countries, for those who are elderly and those who are vulnerable. But there's a question over whether it's right to give booster shots to young 18-year-olds, for example, who have already been vaccinated when, as we heard there from that international pandemic response report, you have many millions of people across the world who haven't yet get one vaccine, elderly people, hospital workers in parts of Africa. So it's a very difficult area to go on. And the question is, Paul, is in relation to the EU's COVID certs, then should you have boosters attached to that when not every country is going to be giving boosters to everyone? So it's going to be quite complicated. I think the main issue now is for a coordinated response in terms of restrictions and for member states and for citizens to do what they can to try to quell the tide here.